Hello, sisters. Welcome to the Sacred Medicine Podcast, weaving powerful, soulful practices into functional medicine. Step into this beautiful space of devotion and explore everything from nurturing foods, rituals, sexuality, and awakening your innate sensuality. It is time to own your radiance. This is the Sacred Medicine Podcast. And we are back for another week of the Sacred Medicine Podcast. I am your host, Margaret Romero, and this week we have a really special guest. We are talking about a subject that I absolutely love. It is just a huge interest for me. Her name is Dr. Margaret Christensen. She has been a faculty member for the Institute of Functional Medicine for 13 years, and she also became really interested in functional medicine 18 years ago when trying to solve the riddle of her and her family's complex health challenges. Unbeknownst to her at the time were consequences of severe toxic mold exposure. So she became very intimate with mold, and we are talking about mold this week. And it is also very close to my heart because I know my family has had exposure to mold, and so I put myself to learn more about it, probably more than most people. I guess you sort of don't. I think a lot of people tend to see mold maybe in their home or in the basement and, maybe not really think too much about it if they see spots here or there. But it's a big, big deal, and it can cause a lot of health issues. So I wanted to bring mold to the forefront because I feel like it's not discussed. It's not discussed at your doctor's office, and it also, I think, doesn't, for many people, it's like probably, how can that cause something? I don't smell mold, or it doesn't smell mildewy here. And that's, a very common misconception. So this week we are talking about mold exposure, some of the signs that you can find. So we go through some of the signs, even chronic sinus infections. Do you know how many people I see with chronic sinus infections? It's really just, it's something that the majority of doctors or your practitioner will give you antibiotics for, right? And then you're like, yeah, I get this. I have a chronic condition. And now, don't get me wrong, if you have polyps or things like that, that can certainly contribute to chronic sinus infections. But there's also a possibility that it could be mold exposure. And you're living, if it's in your home or if it's in your job, you're there. Do you know how many hours per day? I mean, so many hours per day you're exposed to it. It's not a passing thing where you walk into a room and then you leave and then you never walk in there again. It is something where you are, it's your home. You're there however many hours, at least however many hours you're sleeping there, right? Or, home, or if you're a teacher, schools and all the children that are exposed. So it's a really huge topic. I will definitely be having her back on the show next month so we can talk a little bit more about mold. So we talk about some of the signs, how to test for it, because that's really key, because you want to know, there's functional tests that I have done, that she has done, and so we talk about those. And some of the treatments, what can you do to help if it's in your home and you don't want to move out? Okay, so how can we treat this the right way? What else are we talking about here? We also talk about some of the things that, we talk a little bit about air ionizers and some of the things that we can do to help some of the symptoms. Detoxification is huge as well. And so we talk about that, infrared sauna, there's supplements, there's many things that you can do to eliminate the mold from your body. And it definitely is something that is possible. So if you have had mold exposure, definitely don't think of it like, oh my gosh, I'm always going to be sick, or I can't escape this, because there are remedies. There's lots of remedies, and there are mold experts that will come into your home and help you. And there's also some websites that I'm going to give you the link for that are just amazing resources for certain things, like detergents that'll help with washing your clothes, and certain things that you can put on your rugs. So there are ways. If not, I mean, if there's really a major mold issue, I would most likely throw out the rugs, honestly, and replace them after you remedy things. So this is an amazing conversation. Also, I also want to give a shout out to Margaret Christensen, because she is the host of a very popular cutting edge summit called the Toxic Mold Project. And this is coming up in mid-August. So definitely stay tuned for that. I'm definitely going to be watching it for sure. And I want you to know about it because it is free. So if you want to learn everything there is to know about mold, absolutely you need to check it out. So the link for that will be in the show notes. So on to the show. I'm excited that you can learn as much as you can during this interview, but you will learn 100 times more during that summit. Okay, now on to the show. Dr. Christensen, thank you for being here today.
You are so welcome. Thanks for having me. Two Margarets here.
Yeah. Okay, so this is a topic near and dear to me, as I have also a very family members that currently live with some mold, and they don't think it's a problem. My brother, who's a doctor, doesn't think it's a problem. I know it's a problem. And I would love to shine a light here, because I feel that it is not something that's readily discussed in conventional medicine offices. And I also feel that not enough people, they maybe see a little bit, in their bathroom, and they don't really think that it's a big deal. They could just clean it off. So I just want for us to kind of go into some of the things. And why don't we start with what some of the signs, let's talk about what some of the signs that people may experience if they have mold exposure.
Okay, well, why don't we just start with some of the signs that I experienced? I didn't know what it was, because you're absolutely right. There is no training really in conventional medicine on environmental medicine, which is why everybody in this country has chronic illnesses. Air quality is involved in 95% of all illnesses. And, again, 50% of all illnesses have a direct correlation to the quality of air. So this was 20 years ago, I was just getting more and more and more fatigued. I was having terrible brain fog. I couldn't think straight. And, I'm a very type A personality. I was kind of at the top of my class. I just couldn't keep going. My whole body hurt. I had fibromyalgia. I was having gastrointestinal symptoms, kind of IBS issues. And, I'd go visit my colleagues, and they said, "Oh, honey, you're just stressed, anxiety, depression, and insomnia." Okay, let's throw all those things in there. Here's your antidepressant. Go see the physical therapist. Here's some pain medications. Now, again, at the time, I didn't recognize it, but also everybody in my family was sick in some way. My husband at the time was having bipolar type of symptoms. My 3 out of my 4 were having a kind of ADD symptomatology. One of them pretty severe anxiety, and again, kind of the brain fog. One was having migraines, asthma, allergies, ear infections. So all of these things were going on, and I didn't tie any of them together. And these are the common things that we see here in our practice. So night sweats, sleep disturbances, terrible fatigue, chronic pain, inflammation symptoms, headaches, sinus and sinus infections, and particularly recurrent ones. Those are all, symptoms that you might see. But the kind of a lot of the mystery illnesses that we're seeing too now, chronic fatigue, the POTS types of syndromes where you're having heart racing, you're having anxiety that's coming out of nowhere, you can't figure out what it is, night sweats, I think I already mentioned that, recurrent urinary tract infections and interstitial cystitis symptoms, and frequent urination.
Okay.
When you understand the physiology underlying all this, you understand why you have the symptoms.
So is it mostly due because the mold, the mycotoxins that are released that are causing the havoc?
Yeah. Well, yeah. So again, there's several different ways that mold can impact you. And, again, we have mold in our environment. You go outside, you have the mold counts for the day. That's not what we're talking about, because just mold itself, when you're breathing in, can cause allergic kind of symptoms. So you may, again, runny nose, eyes watery, et cetera, sneezing. But it's when those molds are stimulated to produce the mycotoxins that's the problems, because the mycotoxins themselves are these little teeny tiny chemicals within the mold that can be incredibly toxic to the brain, to the nervous system, to the gut, to the immune system. And so you can have allergy type symptoms, toxicity symptoms. Mold, the mycotoxins really impact your mitochondria. That's the little tiny organelles that produce energy. So you get mitochondrial damage, and that's why you can see all different kinds of symptomatology coming on. So those are some of the main ways that molds and mycotoxins can impact you.
Okay, great. I mean, that's a long list, and I feel like so many people, even they come in to see me with fatigue is so common, and brain fog, headaches, migraines, it's so common, right? And so what does what's the first thing a person has to do if they notice a little bit of mold here and there? Does it normally give off a smell? I mean, okay, I think a lot of people.
But actually, before I answer that question, let me, because you have women listening to this, hormonal disturbances are huge with this, because there are some of the mycotoxins that are hormone mimicking. There's one that's called zearalenone that looks like estrogen. So you can have heavy periods, you can have PCOS type of symptoms, PMS symptoms. Infertility is a big one, and premature menopause. So when I have somebody who's coming in with premature menopause symptoms, or in doctor talk we call that premature ovarian failure, that's what I look like. So getting back to your other question, how do you suspect or whatever? And by the way, so here's the deal. 50% of homes and 60% of commercial buildings have had some kind of water damage. And so what we are worried or concerned about is sheetrock that has been water damaged. That's really the fodder for that grows the most toxic molds. Clearly it's obvious if, for example, you've had a leaky basement or what, it smells real musty or mildewy. Now, again, we've had that for hundreds of years. Why now? Why is that getting worse? And I'll come back to that question. So you asked, well, do you always see it? Not necessarily. And a lot of times things are hidden. If you notice a little moldy patch on a wall, whether it's green or white or black, that's only about a tenth of what's there, because all of the rest of it's hidden behind it. So, but kind of that long list of symptoms that I had mentioned earlier, everything from autoimmune issues to neurological issues to psychiatric issues to hormonal issues, especially if there's a cluster of that happening in a home or in like an office building, then you can start suspecting, is there something going on here? And then clearly, if you know that there's a history of water damage, wherever, so roof leaking, windows leaking, your air conditioner leaking, your water heater breaking, a slow leak in the toilet, and oftentimes these can be hidden. So again, you may not notice it, but then folks start having all these different kind of symptoms. So there's a couple of things that I recommend that folks do. And one of the first things that you can do is go online to survivingmold.com, and you can take an online visual contrast sensitivity test, or VCS test. That's a very rough screening test, but it just looks at how well you can discriminate fine gray lines. Because molds, the mycotoxins are very neurotoxic, and they end up impacting the blood vessels to the eyes. Now, it's not just mold that can cause that. It's also heavy metals, also infections like Lyme can do that. And frankly, all the cases that I see, so I do functional medicine. I have an integrative medicine clinic, and it's never one thing, but toxic mold exposure is often the underlying cause. So VCS test is super simple to do. And then there's some at-home testing that you can do. And I have I'm hosting the Toxic Mold Summit, which will be launching on August 17th through 23rd. And with that, you can download. I have a whole e-guide on what to do. What are the steps to take?
Oh, that's great.
Yeah. And then there's also a secondary piece that looks actually teaching people how mold impacts the immune system. We have the first of 7 modules. I have an advanced immune system course, but the first module is available for free with the summit. So doing the VCS test, and then you can do dust sampling, and you can do special mold plates at home, but don't go to Home Depot and get those mold plates. You want to order them from a reputable source, and immunolytics.com is who I use. But usually
that's where I went.
Yeah. So it's not just one thing that you want to do. You need to get several different sources of sampling. And again, if for those folks listening, if you go to toxicmoldproject.com, when you sign up, one of the free lectures that you can get immediately is Mike Schrantz, who is an indoor air quality professional, and we go through all of the things that we can do, both kind of do it yourself, looking for things, as well as again, hiring a professional to come look. Now, so that is the building side of things, the building or home side of things, and then you have to look at again, testing the person, and there are certain different blood markers that we can do, as well as urine testing for urine mycotoxin testing. Now, your conventionally trained physician is going to be completely clueless about all of this, because I was. And all of my colleagues were, and it took me 8 years to figure out what was wrong, and why I had gotten sick. I got better initially because I worked on changing my diet, and went all organic and into an anti-inflammatory diet, went grain-free, and gluten-free in particular. And things got better because I was able to, and I started taking basic nutrients. You and I laughed about this. I started my journey into functional medicine through Shackley, but I just started taking some basic nutrients to help support my system, and that was enough to help my body start detoxing. Just changing my diet, some nutrients, and kind of improving the quality of my life a little bit better. But I got so sick that I actually had to close my practice. I had a very successful OB-GYN practice. And I was delivering babies like crazy. Now, of course, that didn't help me. And that's the other kind of concept that we often look at, is the kind of the total toxic load on somebody. How much stress do you have? How much sleep? How many antibiotics have you been on your life? Any other illnesses? Any other medications? What's your diet like? So all of those things together. So, okay, I got off tangent. You asked, again, about testing, and I mentioned that, again, that's a pretty big and complex topic, but those are some of the simple things that you can do, some mold plates, and then there's a dust sampling test called an ERMI, Environmental Relative Mold Index. And I use the company that's called EnviroBiomics.com, and they are in San Antonio. Dr. Shoemaker uses mycometrics, which is somewhere on the East Coast.
What was that called again? Myco?
Myco, MYCO metrics, METRICS.
Oh, okay.
Yeah. Mm-hmm. Yeah.
I'll put that all in the show notes.
Yeah.
So let's say somebody has noticeable black mold in their bathroom, or in different places, or basements tend to get mold
Yeah.
easily. Is it something where you feel like they need to, I mean, I've heard people like moving out
Yeah.
completely, leaving everything behind. Do you feel like it could be fixed, it could be remedied, or
Yeah,
does
it
it
can
just depend on the situation?
yeah, well, it depends on the situation. It can definitely be fixed. It can definitely be remedied. Some of the things might need to go. Part of it just depends on how sick somebody is. If you have advanced neurological symptoms, if you have Parkinson's, if you are having, seizures, if you're having severe, debilitating chronic fatigue, or what are called POTS syndrome, postural orthostatic tachycardia syndrome. That's where, you're so weak you can't stand up, you get really dizzy. You're having, severe migraines, you're having severe hives, all that kind of stuff. Then you probably need to get out and leave everything behind, at least for a time being. Now, when all of this happened to me, after I closed my practice off, I had no clue what was making me sick. I just thought, okay, well, I've been doing OB for 16 years. I haven't slept a lot. I've got 4 kids. I mean, there's a lot of stress. I was running my own practice, and none of that helped. But I got better just with changing my diet and taking some nutrients and all that, because I lowered my toxic burden, my total toxic burden. And it wasn't until I got re-exposed that I got super sick again. That I figured out, that was 8 years later, that I figured out, oh, this is why I was sick in the first place. Because we had black mold in our house when we moved out of it, because I had to sell the house because I wasn't working anymore. I got so tired, and again, my kids were sick. But I took it. We took everything with us. I didn't know what it was. I didn't know that was.
Sure.
And
Right.
I still took all that stuff with us. It probably took me a little bit longer to get better, but again, I still didn't know. Now, again, there are plenty of things that you can do to help remediate your contents of the house. There's certain things that you might want to get rid of. If you've been in a hurricane or where everything's flooded and gotten wet, then that stuff needs to go.
Sure.
And again, if you are super, super sick, like we were talking before we went on, I have an elderly couple who she's got significant cognitive and dementia issues, and he's got significant Parkinsonian issues, and they smell moldy when they walk into my office. And they have mildew. You open their closets and they have mildew growing on their shoes and all that. All of that needs to go. And those folks, I told them, you need to get out now, because you are losing neurons too fast, until it can be completely remediated. And you can, one of the guys that I have talking on the summit, his name is Mike McNatt. He's another indoor air quality professional. We talk about ways to remediate contents, but that's a whole other ball of wax. It can be done, but the very first thing you want to do, again, and this is in the guide, if you for the toxicmoldproject.com, it'll say get out if you can. If you're only minorly sick, having migraines, headaches, it's a little bit different too if you're working. So that's a whole nother ball of wax where you're working. I had a lady who was working at a Rolls-Royce car dealership in California, that every time it rained, it leaked like crazy in the office, and the carpets were all squishy, and they didn't do anything about it. They maybe changed the carpet out, but they didn't address the walls and all this stuff, and she got so sick, as well as some of the other people in there. So again, pay attention to, is everybody else sick? Are they having headaches? And if you're in a work situation, are people constantly having upper respiratory infections, et cetera? So
I see a lot of schools being affected by mold.
Oh, that's another whole thing. Yeah.
Yes. And so many teachers would come in with just chronic sinus infections, chronic sore throats, just a slew of things, or they just would feel so sick the minute they walked in there. And so many, I would suggest moving to a different school, but almost all of them seem to be have mold issues?
Well, so this is where if you are a parent kids are in school, I just want all the moms in this country to band together and demand high air quality in schools. High quality air filtration, and also getting rid of all the frigging 5G towers that they're trying to install on schools, because that combination together is terrible. But you're right, schools and dorms are terrible, and a lot of apartments too. Old apartment buildings.
Sure.
And so of course, if you're looking at the whole COVID situation that we talked about before, those cities that are the most humid, that have the oldest buildings, that have the highest levels of air pollution, and that have had water damage, like New Orleans or New York from the hurricanes that you guys
Sandy,
had. Sandy, and Seattle is super humid. So again, high levels of mold end up irritating the immune system in such a way that it suppresses the part of the immune system that goes after things like viruses and bacteria, and it overactivates the part of the immune system that makes antibodies and that makes cytokines. Everybody's heard what a cytokine is now. Those are these inflammatory chemicals. So if you're already primed with that, because you've been living and breathing in a working in a moldy building or in a moldy dorm or in a moldy school, then you're one of the ones that is going to be much more susceptible to getting recurrent infections of any kind, including COVID. And if I just, let me just come back to chronic sinus infections. That is huge. If you have recurrent chronic sinus infections, stop taking antibiotics. That's the worst thing that you can do, because these are fungal. These are fungal infections, and we have a whole protocol that I talk about during the summit. I interviewed Dr. Donald Dennis, who's this amazing ENT who is in Atlanta, about the need to treat with antifungals. And I use a lot of antifungal botanical protocols along with sinus irrigation. We also use ozone diffused through the eardrums. But you don't need antibiotics. You can use antifungals to start clearing it. And there's a lot of things that you can do on your own, because every time you take another antibiotic, it's suppressing the immune system even more. You're knocking off all your good flora, the good probiotic bacteria in your intestines, as well as your sinuses.
Right.
And then you get fungal overgrowth.
I see so many people who come into the urgent care clinic who, I have another sinus infection. All they want is that Augmentin. That's it. And they say, I get several per year.
Yeah.
And urgent care just urgent care is not a place to really necessarily speak on functional medicine. They come for a reason, they pay for a reason, they want their antibiotic. It's just so many times
you got
that I can say no.
Yeah. Well, and then having them do sinus rinsing with, like a sinus rinse bottle. And then again, we use certain botanical essential oils to add to those sinus rinses that are antifungal and start, killing that stuff off. But it's really pretty amazing. I mean, I have a lot of people who come in with chronic migraines, chronic sinus infections, just terrible brain fog, depression, anxiety. And all of those get better when you start just doing some sinus rinsing. Yeah.
Mm-hmm. Yeah. Great. What essential oils do you use in there?
Well, we use, I use different products. One's called Biocidin. Microbalance Health Products has some special stuff to put in it, but mostly on the citrus side of things.
Got it.
Cloves, I wouldn't just kind of randomly start doing that without, because you don't want to overdo it. And that's the other thing too. If you've been sick for a long time and you've chronic infections, you want to be gentle on how you start detoxing, because if you start knocking off and killing off a bunch of your biofilm that's full of boogies, that's full of bad bacteria and mold in it, you can make yourself sick by just releasing too many toxins at once. So we there's a whole protocol kind of approach it. But the good news is that you can get better. Oh my gosh, we have so many folks who get just so much better and they can't even believe it.
Good. Great. I love that.
Yeah.
So we had actually spoken a little bit about 5G and you just mentioned it. So tell me a little bit about, I mean, you had said, New York City and, well, at least it's one of the cities that has old buildings, some air pollution and high humidity and things like that. What are your thoughts around COVID and 5G?
Well, of course, this is an area that if you even mention those two things in the same sentence, you get sent. Yeah, so you want to be careful about that. But it's very interesting that these electromagnetic fields, particularly this new frequency, this latest rollout frequency, markedly affects cell membranes in the body. And our bodies are electromagnetic fields. Most of our cells work in electromagnetic fields. The reason that we can do an EKG on the heart is because of the electromagnetic field of the heart. We can do an EEG on the brain and pick up the electrical activity of the brain. So, of course, being surrounded by electromagnetic fields is going to impact us in some ways. And we certainly know that the cities, again, with the highest death rates around the world, were also cities that implemented that particular frequency of technology at high levels early. And and there's a whole summit out about that if folks want to learn, and I really strongly encourage you to do that, because I think that we have a trifecta that's really causing all the chronic illness that we are seeing. One is poor air quality, and toxic mold is a huge component of that. And again, the molds get much worse and emit more mycotoxins when they're around high levels of electromagnetic frequencies, including that frequency that I mentioned. So, so you have poor air quality along with electromagnetic smog that's happening, the EMF smog from just everything that we're all the technologies that we're using now. And there are, the good news is there's ways to mitigate that, but we also have to wake up and become conscious and actually stop that frequency that we talked about being rolled out. And there's a lot of data on how we can do that. So if we look at air quality, electromagnetic fields, and then our food supply and genetic modification and Roundup in particular, which is also known as glyphosate, those three things together have so impacted our immune systems to create chronic immune inflammation again and disrupt the immune system to suppress the innate and overactivate the adaptive. So that is one of the reasons that we're seeing just these epidemics of illnesses beginning with our children, obesity to, neurodegenerative diseases to ADD, autism, et cetera, the whole thing. So when you start waking up to all this stuff, the good news is our body has amazing ability to heal itself. And so if we just taking out what's toxic and putting in what's missing, and you've experienced that personally, right? So.
Yes.
Yeah.
Okay. So one of the things that I wanted to talk about, so let's say, because I've also had a lot of those teachers asking about how they can get mold tested. Yeah. And I don't feel like I don't feel that we as an urgent care, we're doing that's not what we're necessarily there for, is to do, they don't really know which mold testing to do. But let's say somebody, and a lot of the providers were sort of sending patients to allergists.
Allergists, yeah. Okay, so allergy testing, the standard sort of allergy testing is what's called IgE antibodies, and that's if you have an immediate reaction to something and you get like hives and sneezing. But unfortunately, that's not a really good way to pick up molds. And you can do some blood testing for, again, allergens, and you can do the skin prick testing, which is commonly done for allergens. But that is not usually going to pick up the type of problem that we see with chronic toxic mold illness. And like I said, most of my colleagues are pretty clueless. I know because I went to them, and I was completely clueless myself until I got sick. So There is urine mycotoxin testing that's available where you can actually measure mycotoxins in the urine, and that there's a couple companies that out there that do it. One of them has to be ordered through a practitioner. The other you can order on your own, but the problem is that you kind of really need to know what you're doing. But you can certainly
how to interpret it.
Yeah, and how to interpret it. Yeah, and so so there's urine testing, and then there's a lot of different blood markers. So there's a guy whose name is Dr. Richie Shoemaker, and he wrote a famous book called Surviving Mold, and I sent you the survivingmold.com website to do the online VCS test. There's a number of blood markers that are basically cytokines. Again, these inflammatory chemicals that we can measure. There's one called TGF-beta, another one called MMP9, one called C4A. So those are some of the blood things that we can measure. But again, your conventional doc is probably not going to know so much about that. They may know about C-reactive protein, and that may or may not. That's another inflammatory cytokine marker that may or may not change with toxic mold. But the combination of having, number one, the first thing I do is take a really good history. And I ask people about every single house that they've been in since the time they were born, and, where were their parents living when the mom was pregnant with you? And, and every place that they've lived and worked, and, kind of going back for a history of, do you remember any leaks, any any water issues, any storms, any musty or moldy smells? I grew up on the East Coast. I grew up in Connecticut and New Jersey. And of course we have basements, so that was my first exposure. And oftentimes it's not that first exposure that's going to cause the problem. Mycotoxins are fat soluble. You get them in your body and they stay for long periods of time and they accumulate over time. And the more you get, again, the more you're suppressing the innate and triggering the adaptive immune systems. And so it may not take, once your bucket is really full and you've got lots of stressors and you're not getting enough nutrients, you're not having enough antioxidants, you're not getting enough sleep. I mean, these are all the things that were going on with me. I had a lot of other chemical exposures as well. I was in a hospital. There's lots of chemicals in hospitals, as you know. And, using pesticides, for God's sake, if you are using any plug-ins or Febreze or any fake air fresheners, get rid of them immediately.
Yeah, they're horrible.
That is one of the worst things that you can do. Again, when you're breathing those things in, it really impacts the immune system in your lungs and your sinus cavities. So now I forgot what the question was. But I got off on
no, I had mentioned about testing.
Yeah, testing.
I love doing the urine test. I think I love doing that. Though I haven't done too many blood markers. I know there's like a slew of them for mold. You can even find some markers in organic acid testing, but I really love the urine test personally.
Yeah. So oftentimes, now when I'm working people up, I'm getting a whole panel of testing. I'm looking at hormones, and I'm an OB-GYN by my original training, and so you have to understand that sex hormones interact with thyroid hormones, interact with adrenal hormones. So I want to look at all those things together, and so I'm looking at that. I'm looking at blood markers of inflammation. I'm looking at organic acid testing because I want to see, do you, again, have markers of fungal or yeast overgrowth, and as well as, mycotoxin testing. And then from there, then I'll do other things. And again, you live in the area of the country where Lyme is much more common, and although it is here too. And so, what I tell everybody about any kind of infections, the mold mycotoxins really can suppress the immune system to allow other infections, whether it's bladder, whether it's, sinus, whether it's tonsils, whether it's strep throat, ear infections, bronchitis. Those recurrent infections happen, and then we take the antibiotics knock out our immune system even further. Fungal and yeast and candida overgrowth happens. It produces its own mycotoxins. So you have both an internal and an external problem.
Yeah.
So I might do fungal testing. So again, I that's what I look at organic acid tests. I look for fungal markers.
Sure, sure. Okay, so let's say someone knows that they have mold. They're trying to figure out if their headaches, their migraines, sinus infections, the fatigue, that they go to their conventional doc, they get just standard blood work, all comes back fine. They end up finding someone else, getting other testing, it comes back positive for mold. So now what? Like what are a couple of different ways to sort of, you had mentioned some that you had done, but maybe we can go through that just again, what people should be thinking about doing or not doing.
Okay. Yeah. And then, before we get there, I just wanted to also mention that psychiatric illnesses, and particularly if you have anxiety that's coming out of nowhere, that's just one of the other things that you need to think about. And chronic depression may also have a fungal and mycotoxin component. So what do you do? So again, part of it depends on, okay, how sick are you? But if you can, you try and get out of the situation. And if you can't, even for temporary, you want to try and improve your air quality, get high quality air filtration. I have some recommendations on that in that handout. And then you absolutely want to put yourself on an anti-inflammatory type of diet. So we use an autoimmune paleo diet to help decrease that. And molddetoxdiet.com is another website that I have with Dr. Gail Clayton, where we walk somebody through all of this.
I'm sorry, was that mold detox?
Molddetoxdiet.com.
Oh, diet. Okay. .com.
Yeah.
Great. Thank you.
And if you sign up for the summit, then you end up wanting to buy the Mold Detox Diet, and you can actually get it cheaper by buying it through the summit.
Great.
So, I mean, we work with diet, and then we work with binders. So you need to take some kind of binders to help start binding up the toxins. And there's lots of different things we can use: charcoal, clay, chlorella, zeolite. There's prescription ones that we use. Cholestyramine is one of them. Welchol is another one. But before again, if you're having a lot of gut issues to begin with, and that's something else that can happen, SIBO and SIFO, small intestinal bacterial overgrowth, and SIFO and IBS type of symptoms, lots of gas, bloating, that's super common in mold exposures. Before you take a bunch of binders, which are constipating, you need to make sure that you got the bowels moving. And I like to treat. We have protocols to kind of work on treating leaky gut. We start with the diet, and we use nutrients that help to treat leaky gut, and then we use binders, and you just start binders, and it's binding and sweating, and peeing and pooping. Those are the things that you want to do to help excrete the mold toxins. And you might want to do some lymphatic drainage. So again, there's kind of a whole list of things that you can do to start working on detoxing yourself. But you got to get rid of all your crappy personal care products and fake, and toxic cleaners, and again, fake smells right there. That'll make you feel better. And then working with your diet.
And how do you feel about going back to the sweating, infrared saunas?
So yeah, infrared saunas, coffee enemas, again, like I said, lymphatic drainage, whether you do manual or things like getting a rebounder, using a she machine. All of those things are super helpful. And
what is it? Did you say she, Miss Sheen?
A chi machine. Cheese.
Oh, chi. Okay, sorry.
Yeah, those are all things that help get your lymph system flowing, because that's the other thing. So when you have a lot of toxins in your system, the lymphatic system gets backed up and all gummy, and you're not. So the lymph system, what it does is it drains all the fluids out of tissues, and it dumps it back into our blood vessels. But people have heard of lymph nodes. The reason you get lymph nodes swollen is because you have either infections or toxins triggering the immune system cells that are sitting in those nodes to try and eat those toxins up, or cancer cells or whatever. And it grows and swells, and everything backs up, and that can lead to swelling, edema, et cetera. The other big symptom, again, that women kind of pay attention to, if you have rapid weight gain coming out of nowhere, you've gained 30 pounds in a year and you haven't really changed your diet or whatever, then that's the other thing I look for is mold. Yeah.
Oh, okay.
Mm-hmm.
Great.
That's a biggie.
And I really love dry brushing.
Mm-hmm. Oh, that's amazing. Yeah, that helps to clear the lymphatic system. Yeah.
Right.
That's a really good thought. Yeah. Dry brushing, loofah, Epsom salt baths, really hot Epsom salt baths can be really helpful. And then I encourage folks to put some essential oils like frankincense and lavender in the bath. All of those, you can do Epsom salts with baking soda, kind of combo, and then some essential oils that can be super helpful. And then, dry skin brush before you get in. While you're in, you use a loofah on yourself to really kind of stimulate those lymphatics. And then make sure that when you get out, you take some binders. And there's a nutrient that's called glutathione. Glutathione is the body's most potent antioxidant. And it's also a detoxing agent that's found in, every cell and in the liver. And so, we use both precursors to glutathione as well as glutathione itself to help mobilize toxins and get rid of it. So, the idea is, ideally remove yourself from the source, do some sinus rinsing to get rid of any boogies that you've been breathing, if you've been breathing all that stuff in. And that's probably the number one thing. And I don't know why they're not telling people to do that for COVID. And that's like one of the number one things I tell people is do some sinus rinsing every day. Take a shower inside your nose. Wash out the stuff that's in there that's triggering your immune system. So sinus rinsing, and then again, anti-inflammatory diets, using nutrients that support just basic B vitamins, some vitamin D, and vitamin C is a good antioxidant. There's a very specific form of vitamin E that's called tocotrienols that can be super helpful. So those are the things that we do is, again, basic nutrient support. We're trying to identify what might be missing with you on an organic acid test, and then start binding. And you got to keep the bowels flowing, and you want to sweat, you want to pee. Yeah.
And what form of glutathione are you doing? IV pushes there, or are you doing liposomal?
We give everybody liposomal orally, and then at my clinic we do a lot of advanced IV therapy. So we do IV ozone therapy, which is really, really good for any kind of chronic viral infection, any chronic heat infection, any bacterial, any chronic fatiguing issues, mold exposures, and the virus that starts with a C and ends with there's a V in the middle and there's a D at the end. That's been taking everybody down. We can't say those two words in the same sentence without being censored.
Right.
And so that's very good. We do again, you do IV vitamin C, and those modalities, IV ozone and IV vitamin C in high doses, are being used in several places around the world right now to help treat people who are really, really sick with this thing that's happening to all of us.
Oh, the ozone. Using the ozone.
Yeah. So we do that, and then we do glutathione. We'll do Myers cocktails, which is like B vitamins. Another very huge mainstay of the work that I do is using what's called the PK protocol. PK stands for Patricia Kane. And I forgot. Okay. Now, okay. Yeah. Sorry. Is this going to be edited?
I can edit it. Yeah.
Sorry. Anyway, but the PK protocol, Okay. So PK protocol utilizes phosphatidylcholine, liposomal phosphatidylcholine, and to help replace damaged cell membranes that are full of these mycotoxins. So again, I mentioned earlier that mycotoxins are fat soluble. So they get in all the fat things that we have in our brains, in our breasts, in our bellies. They trigger more fat deposition. But the cell membranes themselves are made out of two different layers of what are called phospholipids, and it's a sort of a type of fatty layer in the middle with some water-soluble layers on the outside. The toxins get trapped in between that layer in the cell membranes and in the mitochondrial membrane. And 80% of that cell membrane is made out of phosphatidylcholine. So if you got somebody who's got psychiatric issues, they've got neurological, neurodegenerative diseases, they have ADD, autism spectrum, phosphatidylcholine is one of the things that I use all of the time. And Dr. Kelly McCann, who I interview on the summit, she's on the first or second day. She and I go into extensive details about using the PK protocol, and we can do that IV as. Mm-hmm.
Yeah, I was going to just say, you do use the IV.
We do. I do it IV, but again, most people have on some oral. So, and what that does, a phosphatidylcholine lifts stuff out of the membrane, and then you can helps replace those damaged cell membranes with new phosphatidylcholine, and there's other components to it, including glutathione, including something called butyrate that we use together. So again, all of these things are useful to put together to help create you want detoxing, and then you want rebuilding new healthy cells.
Sure. Got it. Well, wow, this has been such a, I just wrote so many notes today. What wisdom you have around mold. It's just been such a pleasure interviewing you. Why don't you tell us how we can find you? And I'll have all of the summit information on there as well.
Okay. Well, sure. And before that, I just wanted to say that, again, chronic illness of any sort, and often with environmental toxins and toxic mold exposure, it can be very difficult, and people are often sick for a long period of time before they even figure out what it is. And it can be very discouraging when you feel crappy. It feels really overwhelming. So I think it's absolutely critical and important to have some sort of daily practice, meditation, prayer, connecting to something greater than oneself, focusing on gratitude, on what's joyful in life, and on celebrating the baby steps. Because otherwise, there's sort of a PTSD type of thing that can happen. And so I just get everybody to quit watching the news. We do a lot of vagal exercises, singing, and humming, oming, all of that, and really focusing on the positive and what's nourishing is incredibly important in any type of recovery. And that was for me as well, and for our clients. So I just think that part is really super important. And I know that's near and dear to your own heart and to your own practice of medicine, is acknowledging the sacred. And this is an amazing time to be alive right now. We have, the first time, in the history where you have sort of a global still point for everybody, forced silence and meditation. And, we have to be thinking about, what we can do differently to change our environment. And we have to start by changing our internal environment and our internal talk. So I think that's real important.
Great.
So in terms of, reaching me, well, first of all, toxicmoldproject.com, or you can just Google Toxic Mold Summit, and I'm sure you'll have a link that your listeners can will be able to sign up through. And my practice is at carpathiacollaborative.com. So Carpathia is CARPATHIA, and the word collaborative, COLLABORATIVE.com. The Carpathia was the name of the ship that picked up the survivors of the Titanic. So we have the Titanic of Western Mediterranean. Yeah, the Titanic of Western.
I didn't know that.
Yeah, that's just treating the tip of the iceberg and foundering because of it. And so it's really important to look at root causes and to at all levels, body, mind, and spirit, and trauma too. And I'm sure you've had folks talk about again the role of trauma. Another important thing that I talk about is head injuries. So, but that's for another time.
Okay.
Yeah.
Well, thank you so much. I will have all of these links in the show note as well. And thank you so much for enlightening us on mold, toxicity, and mycotoxins, and the importance of getting tested and just being able to get rid of all these symptoms that a lot of people, these symptoms are so common. I guess, blood blood work comes back normal, you really need to dig deeper and look for another avenue.
And I can just tell you that it's the most common underlying cause of chronic illness that we see, and it's gone completely unrecognized by conventional medicine. So.
Oh, totally. Well, I thank you so much.
So welcome. Thanks for having me.
Wasn't that an amazing interview? So, if you are interested in the Toxic Mold Summit, it is free. The dates are August 17th to the 23rd. In the show notes, I will have the link. I will have other websites that give you so much information if you're looking for detergents for your clothes. And so there's just a multitude of products that will help you with this mold issue if you're currently suffering from it. Or if you don't even know that you have a mold issue, but you have these like recurrent symptoms, you're not really sure why, or headaches or sinus infections. I mean, the list goes on and on. Then you can do some quick and easy mold testing. You don't have to hire somebody to come to your home and spend thousands of dollars to do it. You can do it. And I'm going to put the link in the show notes. So you can buy, I think there are like these agar plates that you put in the room that you want to test for a certain amount of time, and you close it up and then you ship it in. And I believe, do not quote me, that each plate is like maybe $3. I have done that. I've also hired somebody too. So the subject of mold is one of my favorite things, because it is also one of the things that I think about when I have a patient coming in with issues and I cannot find why they're having problems. You got to think about mold. They have, mycotoxins that cause and wreak havoc in your body. So really important to get appropriate testing for your body, and also testing for your home. So all links will be in the show notes, and I'll see you at the summit because I will be there as well. I'm not going to be lecturing. I'm going to be listening in. So I can't wait to just learn as much as I can about this, and I hope you'll be there as well. So if you head on over to margaretromero.com/episode 141, everything will be in there. And that's it. I hope you're having the most beautiful week wherever you are in the world. I hope that you are healthy and happy. Thank you so much for listening, and I will see you all next week. Bye for now.